Now let me take this opportunity to speak to you all about colon cancer. Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital, Bannerghatta Road in Bangalore. Colon cancer is certainly among the more common cancers. It is a cancer about which most people should be aware about. Now, what are the symptoms of colon cancer and who is likely to get it? Now, the common symptoms of colon cancer are altered bowel habits. So, very often we have patients coming with alternating diarrhea followed by constipation, and they have to put pressure to pass stools. And apart from that, sometimes they develop abdominal cramps, they develop pain while passing stools. These are the common symptoms which warrant a colonoscopy. Many of these symptoms may not necessarily be due to cancer, but especially in a person who is of an older age, that would make us worried that this can be cancerous. Some patients can present with blood in stools. Any blood in stools, especially in an elderly person, should warrant us to investigate further. Only a small fraction of patients present with advanced symptoms like loss of weight and loss of appetite. Now, who is susceptible for colon cancers? In other words, what are the causes for colon cancer? Now, very often we don't get a specific reason why a person develops colon cancer. But in about 10 to 15% of the cases, there is a family history of colon cancers, and nowadays genes are identified that make certain families susceptible to develop colon cancer. There are various familial cancer syndromes. There are conditions known as familial polyposis coli or Lynch syndrome, which make families susceptible to colon cancers. Apart from this, very often, especially in the Western countries, people undergo routine colonoscopy, and quite often it is possible that polyps are found in the colon. More often than not, these polyps are totally harmless and are not cancerous. But certain polyps do predispose the person to develop colon cancer in future. Polyps which are flat or villous polyps, as we call them, or those polyps which have dysplasia or precancerous changes, these are the polyps which are more likely to go on to become cancer. How are colon cancer treated? Now, before that, let me tell you how it is diagnosed and staged. The most important test for a colon cancer is colonoscopy, where a tube with the light is passed up the anus and the entire colon is visualized, and where there is a growth or cancer is suspected, biopsies are taken. The biopsies are sent to the pathologist, and the pathologist will confirm if there is a cancer or not. Once the cancer is diagnosed, like in any other cancer, we have to stage and see how much it has spread. For this, we may order various tests like a PET scan, which is a whole body scan which shows where all the cancer has spread. We may do a CT scan or a MRI in certain specific situations. There is a blood test known as CEA, which we call as a tumor marker, which is very useful in following up colon cancer patients. So a high CEA would suggest the possibility of a metastatic disease. With regard to treatment of colon cancer, there are 2 or 3 important treatment aspects. Surgery is the most important aspect of colon cancer treatment. That part of the affected colon has to be resected and the 2 ends can be joined. This procedure is called a colectomy, and depending on which side it is done, it can be a right colectomy or a left colectomy. Nowadays, these operations are done by minimally invasive method, by laparoscopic method and robotic method, in which the patient has to suffer less pain and the hospital stay is shorter. Apart from surgery, the next important treatment is chemotherapy. Chemotherapy helps to prevent, these are basically injections, and they prevent spread of cancer cells elsewhere. So a person who has been operated, if he is at high risk of developing metastatic disease, there may be a recommendation to take chemotherapy even after surgery. Radiation is not very often used in colon cancer. Radiation is more often used in the last part of the colon or in rectal cancers. But this is a separate topic on its own. By and large, for colon cancer, radiation is not used. Now, depending on the stage, the treatment may be recommended. Like in early cases, surgery is the most important treatment. If the cancer has spread too much and cannot be operated upon, in these cases, we may go for chemotherapy. So, this is the way in which colon cancer is diagnosed and treated. Thank you.